Well, you are most likely dealing with a condition called plantar fasciitis. And it's one of the most common conditions we treat in our office. And in my 32 years of practice, I've observed that it's become somewhat of an epidemic. And it affects all different types of people: young, old, thin, heavy, people that like to work out, people that are sedentary. And it's a condition that's related to what's called the plantar fascia, which is a tendon that connects into the heel bone. When we talk about plantar fasciitis, let me try to give you an example when I talk about the mechanical condition. This is an example of a cross-section of the foot. And basically, when we look at the foot, there is a heel bone here, and then there is a thick band of tissue that I describe as a stalk of celery that connects the heel to the forefoot. And the purpose of this stalk of celery or thick band of tissue is that during the gait process, this helps to stabilize the arch. And it goes through a period where it's loose, and then it goes through a tightening process. So when we look at a condition like plantar fasciitis, it's not just pressure on the heel, but during gait, there's an actual mechanical process where this tendon is pulling on the heel bone. So the heel is subjected to the pushing elements of the floor and ground reactive forces and the pulling element. When people come to see me for this condition, typically it's a very inflamed, painful condition. Not only is it inflammation, but it's also what it does from an activity level. A lot of times people become more sedentary. When they finish work or they finish their day, all they want to do is be on the couch, and they start to lose their mojo. They can't be active, they can't do activities, they tend to gain weight, and it's a real lifestyle issue, and it does make a significant difference in a patient's lifestyle and physical activity. So when I focus on this, what I focus on is the acute inflammation, and we have a variety of ways that we help that. We can use braces to lift the arch up, we use medication by mouth, sometimes we use steroidal medicine to reduce the inflammation, and most of the time we're able to get that acute inflammation under control. When that's under control, we look at the chronic causes. The chronic causes being the structure of the arch, the way that a patient functions, and that might be physical therapy to do at home, shoe gear modifications, orthotics or inserts to lift the arch. And I think the way we look at this differently is I don't just focus on getting you better, I focus on keeping you better. And for this condition, that is very important. Most people respond conservatively to this condition. If not, we do have several different treatment options to take care of this from the long-term nature. There's a surgical procedure which is done with a microscope that's very effective. And we also have a shockwave technology that's based on lithotripsy technology, and I'm proud to say we're the only group in the triad that has this technology. And non-invasive in the office, it can be very effective for approximately 80% of patients. My message is take plantar fasciitis seriously, because it's not just the pain, it's also change in activities and lifestyle.